A 38-year-old lady came to the surgery today. She'd been complaining of amenorrhea for 6 months for no obvious cause. She'd done a pregnancy test and it had been normal. I had seen her previously and gone on the map of medicine to try and work out what sort of investigations I ought to do. And she'd had the tests done and she came back for review to find out what the next steps were. I had map of medicine switched on in the background, and so I just opened it up, typed in amenorrhea to remind me of it, went to infertility ovulation disorder, which is the second option, and this was suspected ovulation disorder, assess hormone profile. These were the tests that I'd actually ordered: progesterone levels, the FSH and LH levels, prolactin, thyroid function tests, testosterone, and considered the ultrasound scan to see if there was any reason for it. And then in terms of the diagnosis, this is why she'd come back to me. The 5 conditions were: no specific diagnosis, premature ovarian failure, hypothalamic pituitary dysfunction, hypoprolactinemia, and polycystic ovary syndrome. Again, looked at her blood test results and looked at the information here to see if any of these tests were abnormal. In fact, all the results had come back all within the normal range. And so, looking at this screen, I explained to her that I'd excluded premature ovarian failure, hypothalamic pituitary dysfunction, hypoprolactinemia, and polycystic ovary syndrome. I clicked on no specific diagnosis and explained that 10 to 20% of female infertility is unexplained, and then went on to say that we could go down this route if she was planning on trying to start for a baby. Now, in fact, she wasn't starting for a baby at the moment, and that wasn't a consideration, but it may become a consideration later in the year. So my advice to her at the time was to say, well, let's wait and see what happens, perhaps give it another 6 months. If a period comes out, then great. If on the other hand it still hasn't come back in 6 months, so she's had a year of amenorrhea, then I'd ask her to come back again so we can take things further. Alternatively, she decided that she wanted to start to try to conceive, then she ought to come back at that point then, and then we could go further down this route. She was happy with the consultation. I was able to inform her that she could see this pathway that I'd looked at on the map of medicine through NHS Choices, and she was happy to go with the advice.